Have you ever heard stories of women who didn't know they were pregnant until they were in labor? It might sound like something straight out of a TV show, but it's a real phenomenon called a cryptic pregnancy, or a silent pregnancy. It's when a person is pregnant but doesn't have the typical symptoms, or misinterprets them as something else. Today, we're diving deep into the subtle and sometimes confusing signs of a silent pregnancy. This isn't medical advice, but it's fascinating information that sheds light on just how different every pregnancy journey can be. Always consult a healthcare professional if you have any concerns about your body. So, what exactly is a cryptic pregnancy? It's estimated to happen in about 1 in every 475 pregnancies. That's more common than you might think. The reasons can be complex. Sometimes it's due to hormonal imbalances, like those seen in polycystic ovary syndrome, or PCOS, which can cause irregular periods. Other times, it could be related to perimenopause, when periods are naturally becoming erratic. Very low body fat, often seen in athletes, can also stop periods, making it hard to notice a missed one. And for some, recent childbirth can mask a new pregnancy, as postpartum cycles can be unpredictable. Let's talk about the most classic sign of pregnancy, the missed period. In a cryptic pregnancy, this sign is often absent or misleading. Some women continue to have what seems like a regular period. This isn't a true menstrual period, but rather implantation bleeding or other forms of light spotting. Because it can be cyclical and resemble a light period, it's easily mistaken for one. If you have a history of irregular cycles, you might not think twice about a missed or unusually light period, chalking it up to stress or normal fluctuations. This is a key reason why a pregnancy can go unnoticed for months. What about the morning sickness, the nausea and vomiting we so often associate with early pregnancy? Well, not everyone gets it. And for those who do in a cryptic pregnancy, it might be so mild that it's dismissed as indigestion, a stomach bug, or a side effect of something they ate. Instead of intense, daily nausea, it might just be a fleeting feeling of queasiness here and there. It's easy to overlook when it doesn't fit the dramatic picture we have in our minds. If you're not expecting to be pregnant, your brain will look for other, more plausible explanations for feeling a little off. Then there's the baby bump. We expect a growing belly to be an undeniable sign, right? Not always. In a cryptic pregnancy, the baby's position can make a huge difference. If the baby is positioned towards the back, or if the mother has a retroverted uterus, which tilts backward, the bump might not be prominent at all. For women who are overweight, a small increase in abdominal size might not be noticeable or could be attributed to weight gain. Similarly, very fit individuals with strong abdominal muscles might not show in the typical way, as their core muscles hold the growing uterus in more tightly. Let's discuss fetal movement. Those first flutters, often called quickening, are usually felt between 16 and 25 weeks. But what if you're not expecting them? It's incredibly common for these subtle movements to be mistaken for gas, muscle twitches, or indigestion. Think about it. We all get little rumbles and gurgles in our abdomen. If pregnancy isn't on your radar, you'd naturally assume it's just your digestive system doing its thing. The placement of the placenta can also play a role. An anterior placenta, which is at the front of the uterus, can cushion the baby's movements, making them much harder to feel, especially in the earlier stages. What about pregnancy tests? This is a really interesting part of the puzzle. You might think a simple home pregnancy test would solve the mystery. However, in some cryptic pregnancies, hormone levels of HCG, the pregnancy hormone, can be unusually low. They might be too low to be detected by a standard urine test, especially if the test is taken at the wrong time or if the urine is very diluted. This can lead to a false negative, which provides a powerful and incorrect sense of reassurance. In rare cases, blood tests might also show lower than expected HCG levels that don't rise in the typical pattern, further confusing the picture. Another factor is the psychological aspect, often called denial. This isn't necessarily a conscious denial. It's more of a subconscious inability to accept the possibility of pregnancy. This can happen for many reasons. Perhaps someone has been told they're infertile, or they're using what they believe to be reliable contraception. The mind can be very powerful at explaining away symptoms that don't fit our reality. If you genuinely believe you cannot be pregnant, your brain will work overtime to find other explanations for weight gain, fatigue, or funny feelings in your stomach. It's a protective mechanism, in a way, but it can mask the truth for a very long time. Let's look at some other subtle signs that often get misinterpreted. Fatigue, for instance. Extreme tiredness is a hallmark of the first trimester. But who isn't tired these days? It's so easy to blame fatigue on a busy work schedule, stress, poor sleep, or just life in general. It's a non-specific symptom that rarely makes someone think, I must be pregnant, unless other signs are present. Similarly, breast tenderness or changes in breast size can be attributed to hormonal fluctuations related to a normal menstrual cycle, or even weight gain. Backaches are another common complaint. Millions of people have back pain for various reasons, from poor posture to muscle strain, so it's rarely considered a primary sign of an unknown pregnancy. Food cravings or aversions are also classic pregnancy symptoms. But again, these can be subtle. You might just feel like you're in the mood for certain foods more often, or that a food you once loved suddenly seems unappetizing. It's easy to dismiss these as simple shifts in preference rather than a sign of a major hormonal change. The same goes for mood swings. Feeling more emotional or irritable can be easily chalked up to stress, PMS, or just having a bad week. The symptoms of a cryptic pregnancy are often the same as regular pregnancy, but they're either milder, intermittent, or viewed through a lens that excludes pregnancy as a possibility. So what happens when the truth is revealed? For many, it's a huge shock, often happening in a dramatic fashion, like going to the emergency room for severe abdominal pain and being told you're in labor. The emotional impact can be immense. There's the shock of the news itself, combined with the realization that you've missed out on the entire prenatal experience. There's no time to mentally or physically prepare for a baby. This can be an incredibly confusing and overwhelming time. It's so important for individuals in this situation to receive compassionate care and strong emotional support from healthcare providers, family, and friends. Remember, every person and every pregnancy is unique. The textbook symptoms we learn about are just a general guide. The human body is complex and can behave in unexpected ways. Cryptic pregnancies highlight just how adaptable and sometimes deceptive our bodies can be. They serve as a powerful reminder to listen to your body. And if you feel that something is off, even if you can't quite put your finger on it, it's always worth speaking to a doctor. A simple blood test or an ultrasound can provide definitive answers when home tests and symptoms are confusing. If you or someone you know is struggling with mental health, especially after a shocking life event like a cryptic pregnancy, please reach out for help. There are resources like the National Alliance on Mental Illness and other crisis hotlines available to provide support. You are not alone. Thanks for watching our deep dive into the world of silent pregnancies. It's a topic that's both medically fascinating and deeply human. If you found this video informative, please give it a thumbs up and subscribe to our channel for more content about the amazing human body. Hit that notification bell so you never miss an update. See you next time.